So this is session on tumoral and pseudotumoural musculoskeletal lesions, and it's quite a huge task. So the learning objective is that you should become familiar. Oops, there goes my. Yeah, you should become familiar with the imaging characteristics and the imaging modalities to assess bone and soft tissue tumors. We start with the bone tumors. The task of the radiologist is to detect the lesion, to characterize the lesion, to provide a diagnosis, to stage the lesion, and to monitor therapy in malignant lesions. You can start with a plain radiography, and this is still the first choice imaging method for detection of a lesion. And you can easily see a bone-forming tumor in the distal femur of this teenager, so it produces osteoid matrix, and there is a destruction of the cortex on the posterior side, so you can make the diagnosis of an osteosarcoma. Plain radiography is less sensitive in complex areas, such as the pelvis, or the spine, or the skull base. There you have superposition. And usually we will make an MRI for staging and defining the local extent of the tumor. In some cases, you need CT scan to better see the matrix of the lesion, and especially to find the nidus of an osteoid osteoma. CT is a very good technique. So, plain radiography is the first choice imaging method, but in this teenager, I wonder if any one of you is seeing a tumor. That's a problem of plain radiography. It is less sensitive in the early phase when there is not enough bone destruction. So, this was a Ewing sarcoma invading the bone and the soft tissues. And only if you looked carefully, maybe you should have seen this little soft tissue mass. So cross-sectional imaging is certainly a technique which is useful for finding the lesion. So we detect a lesion, now we have to make a diagnosis. How can we make the diagnosis? First of all, the age is very important. Let's look at this young patient, 11 years old, with a lesion in the femur. On T2, we see a soft tissue extension. There is a mass. So it's a malignant lesion, and at this age, only Ewing sarcoma and osteosarcoma can be the diagnosis. Chondrosarcoma and other tumors occur only in adults at older ages. So we will also look at the location within the skeleton. So we have a diaphyseal lesion, and when we look in the proximal femur, only the malignant Ewing sarcoma is mentioned. Other tumors have other preferential locations. We not only look at the age and the location within the bone, but we also look at the location, is it diaphyseal, is it metaphyseal, or is it in the epiphysis? And here we see again that the Ewing sarcoma is occurring in the diaphysis in a child. Osteosarcoma preferentially occurs in the metaphyseal region. And when you have an epiphyseal lesion in a child or a young adult, you should think of a chondroblastoma or an infection. And in an adult, you should think about a giant cell tumor, an infection, or a geode. So the location within the bone is important. You also have to look at the size.